Dr. Shalom Oni is a public health physician. He joins us here in our Lagos studios. Thank you for joining us on the program.
Thank you very much.
So how often or how regular should this decontamination be in light with what we know about the virus?
Well, it depends on the capacity. Really, fortnightly is not bad. At worst, once in a month.
And this is apart from the school resumption. What should people do in their homes as well?
Well, the home decontamination should continue. Every family should have that process, that protocol where you use 0.1% and chlorine, to decontaminate surfaces in the house,
door
handles, and things like that. So that one should also continue at home as these kids prepare to resume.
Okay, let's talk about some of the non-pharmaceutical measures. It's a public holiday yesterday in Nigeria, today, and we're seeing a lot of people moving around, happy, relaxed, and we also have this virus protocols and, wearing the face mask. Some people are tired of wearing the face mask. Physical distancing measures. First, the face mask. I see you have a number of face masks with you.
Exactly.
What do they mean and how do they keep the virus at bay?
Well, we're talking about non-pharmaceutical interventions. We're talking about the personal protective measures where the face masking comes into category. We also have the environmental area and the surfacing. Then we have social or physical distancing. Then we have the travel restrictions. These are the four principal areas of non-pharmaceutical intervention. Now, for this festive period, well, I've seen people, walking around, without face masks, some sagging it, some not using at all, and things like that. By and large, for me, I still think it's fair enough. Some people still go around with a face mask, still observe the protocols. But then I think the enforcement should increase from the side of the government, because what we've been doing is that we've been hearing that, if you don't wear face mask, there are penalties and things like that. But so far, I've not seen anyone being penalized, But then, like the Lagos state government rightly said, everyone should calm down, don't lose your head, use face mask, especially the cloth face mask, in non-medical settings. Then maintain physical and social distance. The urge to want to associate in this season is very high, but we must not lose our head. We must continue. We must use, our PPEs. Then also we must ensure that we limit travels as much as possible. People want to travel. If they want to travel, but then we must, restrict that urge. Make a call. Video call to your loved ones, send them messages for now, just for the sake of this season. So for me, I think that's what we must keep on doing as far as non-pharmaceutical intervention is concerned.
Okay. Donning and, removing the face mask. Tell us about that briefly.
We have two types of face masks. We have the non-medical and the medical. The non-medical is the cloth face mask, which is expected for everyone to use, those who are not in the medical settings. In using your face mask, you're supposed to, first of all, pick up a face mask. You first of all identify it, whether it's dirty or not. If it's dirty, you discard. If it's not dirty, you pick it up. Now, when you pick it up with the band, with the loop. Then you place your hand this way. Look at where the nose is, the nasal area, because you make contact with your nose, you make contact with your mouth, and it must cover your chin. So look at it. I put it on like this. This is how to put on your face mask. And whenever you are using your face mask, if you make a contact with the face mask, you are supposed to go and wash your hand, or use sanitizer. Now, when you are removing your face mask, it's the same approach. You remove it like this. Pull it away from you. Not just, people do this a lot. They just flung it open and say, no, you're going to splash it, yourself. Okay. So this is a procedure. And once you remove it, you take it away from you, you put it in a seed bag where it can be, washed if it's a reusable one. Then you go and wash your hand. But before you even remove, you wash your hands so that you don't get yourself contaminated. These are things you must do. Either you're wearing the surgical, the respirator, or the cloth face mask. These are things you must keep on doing to ensure you're there.
Thank you so much, Dr. Shalom Oni, public health physician. Thank you for joining us on the program. We have more of the COVID-19 updates when we return. Stay with us.